Good evening, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. This is a webinar that you create with your questions, and we discuss anything about Lyme disease. I will try to answer most of your questions to the best of my ability. There are times I get stumped. Probably I'm able to handle about 99% or so of the questions. So I anticipate that will probably be what happens tonight too. So I get a chance to see who's attending. There's a board where I get to see names. I see there's a lot of familiar faces, or names. So for those of you that are coming back here again, welcome back. And then I see some new people too. So for the new people, the way that this works, you get to write questions to me. And there's a chat box over there on that side. And you can use that chat box to write questions to me. The only thing that I ask is when you write the question to me, do not hit the enter key until you're done completing the whole question. Each time that you hit the enter key, it actually sends a separate question my way, which makes it kind of difficult for me to be able to follow what's going on with the question on my end. I am creating a webinar recording tonight, and that will be available sometime tomorrow morning. I usually send an email out to everyone announcing that it is available to be watched somewhere between 6 and 6:30 a.m. Seattle time, which is Pacific Standard Time here in the Pacific Northwest. I am also these days posting it on my Facebook page. The Facebook page is Treat Lyme. And then finally, I also am posting it on my supplement store too on the homepage. I'll show you that to you later. So there's 3 places you can look at it. You can either follow the links in my email tomorrow morning, look on Facebook sometime tomorrow morning early on my Facebook /Treat Lyme, and that's LYME, of course, on the Lyme. And then finally, you can find it at Marty Ross MD Supplements on the homepage as well, too. So there's multiple ways to find information about that. During the webinar tonight, I will be doing some screen shares. I'll show you parts of the Treat Lyme book to show you where you can get more information if I'm not able to answer all of it. As many of you know, that I maintain a pretty extensive written platform called the Treat Lyme book, where I write a lot about Lyme disease and have some very practical and useful articles for you. But we'll show some of those to you later as well, too. All right. And so without any further ado, I'm going to go ahead and get started. One last thing. As we do this, I'm actually going to be displaying the questions on the screen. You'll see them down at the bottom there. And I do read them, though, because sometimes in the recorded version, they don't show as clearly. So I'll make sure that people can hear them. All right. So let's go ahead and get started here. So hello, Craig. Let's see. I was recently diagnosed with POTS and have been wearing compression stockings, which haven't helped. What other things can you recommend for POTS? Okay, so everyone, POTS is the initials of a medical condition called, and it's a mouthful. It's called paroxysmal orthostatic tachycardic syndrome. That's medicine. It's a foreign language. Medicine happens to be a foreign language. So paroxysmal means it happens periodically. It's not all the time, okay, and without explanation. Orthostatic means you drop your blood pressure low. Tachycardic means your heart races. And syndrome means we don't know what causes it. Okay, so anytime you see something labeled as a syndrome in medicine, it means that generally there is not a well-known cause for it, although in the world of Lyme, we think we have reasons for why it happens, but that doesn't mean that the conventional medical community respects why we think it happens in Lyme. All right, so why does this happen in Lyme? All right, and then what are the symptoms you have? Well, let's look at the symptoms first. So basically, when you have POTS, you may have periods where you stand up that you get faint very easily, or you're a person that tends to pass out easily, or you have periods where your heart just takes off racing on its own, okay? And so you have a hard time maintaining your blood pressure, basically. One of the reasons for that can be from 2 of the infections that we get in Lyme disease. One is from the Lyme infection, and the second one is from the co-infection called Babesia. So there's a nerve called the vagal nerve. It's a nerve, it's called a cranial nerve, a vagal nerve, which comes out here in the back of the head, right at the base. And the vagal nerve basically releases chemicals that are anti-adrenaline chemicals, okay? And so they're supposed to balance adrenaline. And so basically it regulates the speed at which we work and how our heart works, how our blood pressure works. and also how your intestines work as well too. So sometimes Lyme can infect that nerve, causing it to dysfunction. Also, Babesia sometimes causes dysfunction in a similar fashion as well too. So first of all, when you have POTS and you have Lyme, make sure you're treating your Lyme, and then consider whether you might have Babesia. And things that make you think of Babesia would be the symptoms, basically, because I don't think testing for Babesia is that useful. And the reason I don't think testing is that useful for Babesia is that we estimate there's about 15 to 20 strains, and we can only test well for two strains. So you got to make a decision if you're going to treat Babesia based on what the symptoms tell you, okay? So symptoms of Babesia can be night sweats, drenching, particularly drenching, soaking the bed night sweats, all right? Secondly, having panic attacks sometimes can be part of it, because you get huge adrenaline surges, which give you panic. Air hunger, feel like you can't get enough air in from time to time. Periods of racing and skipping of your heart. Near fainting episodes sometimes can be part of it. Babesia, often people have headaches here in the front of their head. And one of the strange Babesia symptoms is frequently people will get symptoms of or have frequent deja vu experiences, all right? I find it to be one of the more interesting Babesia symptoms, okay? So in terms of your POTS, make sure you're treating the right infections, okay? That's part one, all right? Number two, you got to do things to get the blood pressure up, to expand the blood volume, okay? So one of the easiest ways to expand your blood volume is to take lots of salt. And so sometimes I have people take a teaspoon to even a tablespoon a day of salt. You just put it in water and you drink it. And what happens when you have salt is wherever there is salt in the body, water is attracted, okay? So you have that salt, it gets absorbed into your blood vessels, and then the water is attracted to the sodium, the salt, and that expands your blood volume. All that extra water comes into your blood vessels, expanding your blood volume so that when you stand up, there is more blood volume to go up with your head so you don't pass out. All right, that's how it works basically. So I often will have people take anywhere from 1 teaspoon up to a tablespoon a day of salt, okay? Second thing that you can do is support the adrenal glands because the adrenals release chemicals that tell your kidneys to hold more sodium in the body, okay? And those are chemicals called mineralocorticoids. So whenever I have somebody with POTS, I want to do adrenal support. And what I like using for my adrenal support is an herbal medicine called ashwagandha. It's a 400 to 500 milligram pill, depending on the brand that you get. And you want to do 2 pills in the morning and 2 pills between 1 and 2. All right, that's going to help your adrenals work better. So they're telling your kidneys to hold more sodium to expand your blood volume. Okay, all right. So those would be the natural ways. The natural ways would be sodium through salt and do the ashwagandha. Okay. Also, another thing you can do is these compression stockings, where basically you're squeezing the blood vessels in the legs so that you more of the blood doesn't pool in your legs. So there's more that stays in the rest of your blood system to go up with you when you stand up. All right. So those are kind of the natural approaches. All right. Then in conventional prescription medicines, one thing that we can do is a medication called Florinef. Florinef has cortisol in it and has the mineralocorticoids in it as well too. And so that would be kind of equivalent to doing the ashwagandha that I was just telling you about, okay? Another thing we can do is a medicine called midodrine, which actually causes your blood pressure to rise by interacting with receptors on your blood vessels that causes them to tighten down, to squeeze, which sends your blood pressure up, okay? You can do beta blockers sometimes, that seems to help. Also, you can, which are a family of blood pressure medicines, especially if you have racing heart symptoms, it slows the racing heart down so that you don't have as many symptoms. Beta blockers would be things like atenolol and toprol, for instance, okay? And then finally, sometimes some of the antidepressant medicines like Zoloft can have some benefit for POTS. Effexor is another one that can sometimes have benefit for POTS, okay? But ultimately, you may need to work with a cardiologist to help with some of this. The way that you formally diagnose POTS is to do a type of test called a tilt table test, where you're laid flat and then you're tilted back up, and they're measuring what happens with your heart rate as well as your blood pressure. And if you have certain changes that they see, then you have the technical diagnosis of POTS. But often you can just diagnose it by what the symptoms tell you as well too. Okay, so treat the right infections, probably Lyme, probably Babesia is part of this. Number 2, get salt going. Number 3, compression stockings can be a helpful part of this. Number 4, make sure you're doing adrenal supports with ashwagandha. That's the natural approaches. If those don't work, look at Florinef, look at Midodrine, look at Zoloft, look at beta blockers, look at Effexor. Those would be my options. Okay. All right. Good luck to you, Craig, and thank you for that question. All right. Hello, Deb. Let's see. I'm doing nebulized glutathione as suggested in your book. I didn't feel I got any improvements with the oral research nutritional glutathione. Does the nebulized glutathione get into circulation? A doctor told me it only stays in the lungs and doesn't get into circulation. What's your opinion? Thanks. All right. So glutathione, everyone, is a very powerful antioxidant that is made in every one of our cells to repair damage, okay? It's also made in high concentration within the liver. It's the main detox chemical. And it is very useful if you have neuropathies because it can help repair neuropathies. It's useful to help with detox. And it's one of the agents I recommend for people that are having bad Herxheimer reactions too, because what it does is it helps remove toxins that are triggering the Herx reaction, and it's a very strong antioxidant that lowers oxidizing agents that tell your white blood cells to make inflammation chemicals called cytokines. So it's one of the things you can use for that, okay? Now, most of the time, glutathione is not well absorbed. So you have to have it prepared in a way for absorption. The Research Nutritionals product that Deb mentioned is something called Trifortify. It is prepared for better absorption by having it microscopically wrapped in fat. Okay, that increases the absorption. And for most people, that can work well, but not in everyone. All right. So then another way to get glutathione in is to do breathing treatments of it called nebulized glutathione. All right. And so what happens whenever you breathe something into the lungs, those chemicals get absorbed into the blood vessels of the lungs and then circulate throughout the whole body. So in the case of your doctor, I strongly disagree. I have a lot of good benefit for my patients by doing nebulized glutathione. It actually does go throughout the whole body. I see systemic benefits by doing that. Yes, the first place it will go to is your lungs. You get some benefits there as well too, but it does go throughout the whole body, okay? All right, another way you can do glutathione is to do intravenous glutathione in your veins. And that's probably the strongest way to get it in there. But really pretty close to that is doing the breathing treatments of glutathione as well too, okay? If you do the breathing treatments, you have to have a compounding pharmacist mix it up, okay? And let me just do a brief article here for those of you that are wondering about how do you use it, how do you dose it, etc. What is glutathione? I'm going to just show you an article here. I'm going to do my first screen share of the night. So, for instance, to sign up for the webinars here on the webinar page, okay? And so anyhow, this, just so you know, this is the Treat Lyme book, okay? Now, I've organized my topics by chapters, okay? And so in terms of glutathione, where you can find that article would be you can find it either in the detox chapter, you can find it in the brain and nerves chapter, and you can find the article in the Herxheimer chapter. All right, let me just do that real quick here. All right, and let's see here. There it is. My article is called Glutathione, the Great Fixer. And in this article, I do review the various forms of glutathione. I even review some supplements you can take to raise glutathione without taking glutathione. Anyhow, there you go. All right. So let me go back here. That answers your question, and good luck to you. Hello, Eric. Let's see. I've been on Banderol Cemento for Lyme and Hatunia and Sida acuta for Bartonella for 1.5 years. I want to try another herbal treatment as I'm not at all better. Any suggestions, and how do I stop these? I'm very sensitive to everything. All right. So, Eric, the problem is I'm not sure. It would be very helpful if I knew more about your symptoms, so I could say whether I agree you have Bartonella or Lyme, so I could help target the supplements. I'm just going to give you some general ideas, okay? So first of all, the two herbs that you're taking, the Hutania and the Sida acuta, are herbs that can be effective against treating Bartonella. And they work about probably about 75% of the time. So if they are not working, generally this is a situation where I'm going to probably try to steer you towards prescription antibiotics. I find prescription antibiotics for Bartonella tend to work better than the herbal options, and those prescription options will work about 85% of the time, okay? And I'll show you an article later that you can take a look at my options for treating Bartonella with prescriptions. However, if you really cannot get anyone to help you with prescriptions, then what you could consider doing is the medicine made by Byron White formulas, that is, called Abart. It's a mix of things that should work against Bartonella. And that you might work up to, I would probably start at 5 drops 2 times a day and work up to 30 drops 2 times a day. I don't give it as great of a success as the Hutania and the Sida acuta, but it could be helpful. The other thing you might want to look at is a formula called BLT by researched nutritionals. That can be useful against Bartonella and Lyme, actually. It has a number of herbs in it that can help with both of those. And I would probably work that up to about 30 drops twice a day as well, too. Okay. But to be honest with you, I would steer you more towards prescription antibiotics on that one. In terms of next things to consider for Lyme, if you've exhausted Banderol Cemento, then usually what I'm going to do is try to go and use an herb called teasel root. It's Teasel. Root. It's sold as a product called Spironil, actually, and that I would start at 5 drops 2 times a day, work up every day by 1 drop per dose, and work up to 30 drops twice a day, and then I might consider combining that. I might try it on its own, or I might try combining it actually with some biocidin. Biocidin is an herbal complex that has a number of things in it. Many of you know I've written an article about biocidin. I like it because it's got petri dish experiments that shows it can treat yeast and remove yeast biofilms. It treats all 3 forms of Lyme and removes Lyme biofilms, and it appears to block a defense mechanism that Lyme has, which are called efflux pumps, where Lyme will actually take the antibiotics that get inside of it and pump them right back out. This Lyme germ is a tricky germ to treat. I mean, look at all these ways that it defends itself, but one of the ways it defends itself is to actually pump the antibiotics right back out, okay? So biocidin has about 10 different herbs in it. The big ones are rosemary. It's got some garlic in it. It's got lavender oil. It's got some grapeseed extract in it. It's a number of things, but I find it to be very helpful for Lyme, and you might combine that along with your teasel. All right. Now, if you're going to use the biocidin, I would start at 1 pump under your tongue. So I'd get the liposomal variety, which is biocidin LSF. There's also 2 other varieties. There's a capsule form of biocidin, and there is a liquid drop variety, but I would get the pump bottle, actually, because it's liposomal. That increases the absorption of it and better chance of it getting into the brain as well, too. Okay. So I would start at 1 pump under the tongue 1 time a day. And every 2 to 3 days, if you're not worse, I would add a pump, initially working towards 1 pump 3 times a day. Once you reach that, then you want to work towards 2 pumps 3 times a day, okay? And if you're getting a herx, don't advance the dose, basically. Now, interestingly enough, the rosemary that is part of the biocidin, I have found helpful for Bartonella too. So if you were to use that, it could also be helpful for your Bartonella, okay? All right. So I'm going to do a quick screen share here. I want to show you guys a couple articles. Up here. So I've written a pretty comprehensive article about biocidin and even reviewed the research on that. So you'll find that here. Take a look there. It kind of talks about all the good things I think that this product can do. Okay. All right. Second thing, in terms of Bartonella, the article that I have about how to kill Bartonella is called Kills Bartonella, a brief guide. And in here, I review some of the herbal options, but I steer people more for this one towards the prescription antibiotic options, and I list them here. So you can either find that by typing Bartonella in the search bar up here. You can click on the search option here in the menu, or where I have all of my treatment plans, the approaches that I use to treat the various infections that occur in Lyme is in this chapter called Infection Treatment Plans. For instance, here's my plan about how to treat chronic viruses if you have Lyme. Okay. All right. So let me go back here. All right, Eric, thanks for that question. Good luck to you. Oh, in terms of stopping these other herbs that you're on, you could just stop them cold turkey. You don't need to do a taper off of them. Okay. All right. Good luck to you. Hello, Linz. Let's see. Hi, Dr. Ross. Thank you for all you do. Oh, you're welcome. I have had Lyme since 2012 and was misdiagnosed for 2 years. I'm currently dealing with PVCs, myelin sheath degeneration, and an immense amount of brain fog. I also feel like I'm not getting enough blood flow to my brain. It often gives me fainting spells. Let's see. And I think you've got a second part here that says any help is appreciated. Let me make sure there isn't a third part to this. Hold on a minute. So, Linz, I don't know if you asked me a specific question, but I'll try to make just some comments here. I'm not finding a specific question, okay? So I'm going to focus on your myelin sheath and your brain fog. Okay, I'm just going to pull those two parts out here. So the myelin sheath, everyone, myelin is a layer of fat that insulates nerves in the brain. Okay, it covers them. And when people have multiple sclerosis, for instance, sometimes that causes the myelin to degenerate. So you'll see absences of myelin. And Lyme can do that too at times. Now, it is possible you could regenerate that or repair the nerve damage. And the way that I'd like to do that, and this is something that can also help with the brain fog, the poor thinking that you're having, is number one, get inflammation down. And the way to do that is treat your germs. Okay, so you got to figure out what your infections are. So with this kind of a picture, I would be thinking of Lyme. And from what you briefly described here, I might be thinking of Bartonella as well too. All right, so if you wonder if you have Bartonella, take a look. There's a whole article in the Treat Lyme book I wrote about could it be Bartonella, the signs and symptoms. Take a look at that. Just in the search bar, you could just type, is it Bartonella? And I'm sure you'll find the article that way, okay? You can have Bartonella and have negative testing, by the way. It's just like Babesia. With Bartonella, we estimate that there's 30 strains of it, but only can really test well for 2 strains, okay? All right. So how do you repair nerve damage? Number one, treat the infections. Number two, lower inflammation. And what I would be using to lower inflammation here is curcumin. Curcumin decreases production of inflammatory chemicals made by white blood cells when they see infections called cytokines. And most people with Lyme, their symptoms are actually too many cytokine symptoms. Okay, so too many cytokines disturb your sleep centers so you can't sleep, make it so you can't think, make you hurt all over, give you fatigue. I could go down the list of what we call Lyme symptoms, and they're actually too many cytokine symptoms by your white blood cells overreacting, trying to get rid of Lyme and not doing a good job. They just overproduce these cytokines, okay? So you want to lower the inflammation, and the way to do this with curcumin, I like a liposomal form, a product made by Thorne called Mariva 500, and I would do 1 pill of that 3 times a day. Okay. Second thing I like to do is provide those nerve cells one of the key ingredients that they use to repair things. That's glutathione. We talked about glutathione earlier tonight. And if I were to use the glutathione, I would use something called Trifortify, made by Research Nutritionals. It is a liposomal form of glutathione. They've got good studies that show that it has good absorption and actually raises level of glutathione in the body. And I would do that as a 5 milliliter, which is a teaspoon, 1 time a day. Third thing I would do is to support electron transfer within your nerves, and I would do that using something called coenzyme Q10 or CoQ10. And for that, again, I like the Research Nutritionals product. It's a 400 milligram pill called I think CoQ10 Best, if I'm right, and it's 1 pill on that twice a day. Okay, so I do glutathione, curcumin, CoQ10, and then finally, I would take the fats that make up your nerve cell membranes, and that's a product called NT factor. NT factor also happens to repair the energy factories found in every one of our cells called mitochondria. But the same fats that repair the mitochondria parts of your cells repair the cell membrane and can be helpful to support the myelin as well too. And I would do NT factor energy by Research Nutritionals again. I like their product. And I would do 2 pills 3 times a day on that. Okay. So those are kind of my nerve repair, nerve support formula. And again, consider whether you might have Bartonella and consider whether you might have Lyme and treat the Lyme as well too. Okay. All right. Let me just go. I'm going to do a quick screen share here again. Called How to Diagnose here. And in here, I have an article called It Could Be Bartonella or Babesia, the Symptoms or Signs. That's the article I would take a look at where I walk through how to diagnose Bartonella. Okay. And then the other thing I just want to show you real quick. Okay. So many of you may be wondering when I mention some supplements by their generic names, how you would go about finding them. Okay, so curcumin, for instance, and you may be wondering, well, what do I think is a good product? Okay, because you got to be careful with supplements. There's a lot of garbage products out there. What I try to do at my supplement store is to curate supplements to find the ones that are from the best companies that have the most active ingredients that could work for you, but also ones that tend not to have a lot of artificial fillers in them. Okay, so if you want to see what do I have for curcumin, I actually have a number of products with curcumin in them. You just go ahead and search up here, and there you go. There's the Mariva 500 that I was just telling you about is right here. Research Nutritionals has something called Curcumin Cure. It's in Cytoquel. It's in a number of the other products here. You'll find the curcumin. Okay, but this is the one that I really like. Is this Mariva 500? Okay, all right. If you're looking, for instance, to figure out what supplements do I have that support the nervous system, you can look here. Just hit this mega menu right here, and you can come down and click on brain and nerves. And in that chapter, you're going to see that I have the curcumin, one of the varieties of curcumin. In here should also be the NT factor that I was telling you about, the CoQ10 I was telling you about, and the 2 kinds, the glutathiones that I was telling you about are right here as well too. Okay, so that just gives you an idea. And those things that I offer in my supplement store are also available for anyone to purchase. And so feel free to come here and get those if you so choose. But I wanted you to see where you can the brands that I use. You would find them at my supplement store, Marty Ross MD Supplements. All right. All right. Let me move on here. Good luck to you, Linz. Hello, Jackie. Let's see. Hi. After being on antibiotics for a year and doing well, I went off last week with the advice of my LMD. Within 5 days, I had extreme pain in my legs and feet. Also, hand and arms and anxiety. Was I not ready to come off, or what is happening? Was on minocycline and Bart. Mino is also an immune. Let's see again. Modulator, I think is what you say. Okay, so it's interesting when you stop antibiotics and things don't go as planned. One of the things you can learn to help figure it out is how quickly things go bad. Okay, so when somebody has Lyme, for instance, and you're in the middle of a treatment and you stop the antibiotics too soon, the symptoms tend not to worsen for a while. And that is because the Lyme germ replicates slowly, by some estimates, maybe even every 4 weeks. And because it replicates slowly, the germ load does not suddenly bloom and take back over, okay? So it's not uncommon if you stop a Lyme germ treatment and it's too soon that you're going to start getting Lyme symptoms back somewhere around a month to even 2 months, okay? So it takes time before that happens, all right? Bartonella, on the other hand, replicates every 24 hours, which means that its symptoms come back a lot quicker, okay? So the return of your symptoms within days, just like this, has me thinking Bartonella is active, all right? And so if you were doing well on antibiotics and some of them were designed to treat Bartonella, and then suddenly you stop and they come back, you need to redesign the antibiotic treatment. And often what I'll do is my Bart antibiotic regimens, I usually tend to use 2 antibiotics to treat Bart. But if I get into a relapse situation on Bartonella, I'm going to tend to use the next time I treat a 3 antibiotic regimen, okay? And that can be herbal antibiotics too, or prescription, but I'm going to use 3 different kind of approaches, 3 antibiotics, herbal or prescription, to go after Bart when I get into a relapse situation. All right, so that's something for you to consider as well, okay? All right, good luck to you, Jackie. Hello, Jennifer. Let's see. Any idea why I would be having huge neuropsychology, nervous system responses to meds I have always tolerated well? I'm being hit like never before. Has to come off doxy. Could we be hitting infections directly in my brain nerves system? All right. So, Jennifer, to really answer this correctly, I probably need to talk to you more directly. I have a number of questions. I'm just going to make one observation, which may not fit your situation, but could fit some people's situation, okay? I would tell you, if you want some more direct help, because I would really, to tease this out, I would have to ask you a lot of questions, a number of questions, essentially do a visit, okay? And that is, I could visit with you. I have a consult service where I visit with people online, and so it would not require you coming out to Seattle for me to see you, for instance. The only drawback to those visits is that because I don't get to examine you, I'm not able to actually legally prescribe drugs or legally order tests. But I do write up a comprehensive note that I send to you that you can show to your provider. And if anything is needed that requires prescription or ordering of tests, they can do that. Otherwise, I give you suggestions you can implement on your own as well, too. So you might want to take a look at that. You'll find it in the Treat Lyme book at treatlyme.net. There's the consult page. Just take a look there, read through the whole page so you understand what you're getting yourself into. It's a really good service, but you should just be aware that I can't prescribe out of it, okay? All right. So, but one thing I find is that when people have been on antibiotics for a while and then they start getting reactive, that could be due actually to the fact that you may have developed too many yeast in your intestines, all right? And that may seem a little bit of a stretch, but let me try to explain why, all right? So when you've been on antibiotics for a while, it's possible that those antibiotics will have knocked down the good bacteria in your intestines, okay? And if the good bacteria is knocked down in the intestines, that allows yeast to grow too much. If yeast grows too much, the immune system sees that and overproduces cytokines. All right, so you're already flared up with excess cytokines. And remember, I've already said tonight, Lyme symptoms are excess cytokine symptoms. Okay, so if you've already got too many sitting there, and then you add in a new antibiotic that maybe does a more effective killing, you've gone over the top already with too many cytokines. Okay, so that's one reason it could happen. Second thing that can happen if you have too many yeast in your intestines is they make a toxin called glutathione. And glutatoxin is a nerve toxin, okay? So now you go in and you change antibiotics and you start killing more germs and they release more toxins and you're already filled up with too many toxins from glutatoxin. You get the picture, okay? So if somebody's really sensitive, the one thing I'm always going to do, especially at the beginning, or if they've developed sensitivity, I'm going to do a lot of screening questions to figure out if there could be too many yeast. And those questions would be, are you having increased sugar cravings or milk chocolate cravings? Okay. So yeast like to be fed. They're going to send out signals that make you start craving their food. Number two, do you have increased intestinal gasiness or bloating? Number three, do you have any vaginal itching, vaginal discharge if you're a female? Number four, do you have increased rectal itching? And then these gliotoxins or toxins in general made by yeast can interact with the skin, and that can lead to pimples or acne or worsened skin rashes developing. And then finally, another yeast symptom can be difficulty swallowing, because sometimes when we get too many yeast in the intestines, that also results in too many yeast growing in our food pipe. And then also sometimes you can get yeast in the mouth to see white patches in your mouth, okay? So I would be interested in knowing, do you have too many yeast, just by what you briefly described, but I would need to know a lot more to find out if that's truly is happening with you to help you with develop a solution to what's happening here, okay? All right. Thanks for that question, Jennifer. Good luck to you. Hello, Margaret. Let's see. I have Lyme with co-infection, Babesia, and Bartonella. I've begun having a weird intermittent cloudiness in my left eye. Which infection is this, and what should I do? Margaret, I don't think of that as being something related in particular to any one infection. And before attributing it to an infection, that is a kind of condition I'd want to have the eye doctor take a look at you to make sure that they're not seeing something going on in the eyeball that could explain this, okay? And that would include whether you might have some kind of a detachment of the back of the eyeball. That might include whether you're developing a cataract all of a sudden. Anyhow, there's a number of things I wonder about with clouding that I would want an eye doctor to take a look at you so they could see if there is a problem with that or not. Okay? All right. Good luck to you. Thank you for that question. Hello, June. Let's see. What are your thoughts on Epstein-Barr virus as a compounding factor with Lyme and co-infections? I have been put on Valtrex and I'm having what feels like a herx, however. All right. Oh, wait a minute. There's a second part. However, I thought you don't herx from bacterial die-off. However, if my cytokine... Wait a minute. Hold on here. Let's see. No, actually, I was doing that correctly. Let me go tune to your second part here. Let's see. I thought you don't herx from bacterial die-off. However, if my cytokines are elevated, I would indeed be herxing. Let's see. Also, what do you think in terms of treatment? Do you think Valtrex is a good option? Thank you so much. All right. So what I'm about ready to talk about, you're going to find in my article on viruses, okay? So I usually don't treat viruses for chronic virus infections until I'm about 6 to 9 months into a Lyme treatment if things are not improving, okay? And the reason for that is if we look at healthy people, if we were to pull 100 healthy people off the street, we would find elevated antibodies, immune system reactions against a number of infections. And those include Epstein-Barr virus. It could include a herpes virus called HHV6. It could include and also HHV8, another herpes virus. Those are respiratory virus infections. It could include something called parvovirus B19, something called cytomegalovirus, and then finally you've got the Epstein-Barr virus, okay? So these are common viruses that live in healthy people. And what the immune system does is it keeps them under control. We cohabitate with them, all right? So most doctors, when they're trying to look if you have viral infections, they're going to measure the antibody levels. They probably measured your IgG and maybe even your IgM antibodies, all right? And because you had some elevations of those, they said you have an infection. And what I would say is, no, you have evidence that the immune system is keeping your germ under control. And the issue is it's not clear. You can't always tell by looking at antibody levels whether the immune system has lost the ability to keep these infections under control, whether they become a problem. Remember at the beginning of this question, I said, these live in healthy people, okay? So just having evidence that they're in you does not mean that they're in you in excess or that they're causing part of the problem, okay? So I don't rely on antibody testing anymore. And so what I tend to do, June, I would go back and relook at how did your doctor come up with the conclusion that there are viruses here? Okay. All right. Now, if you do have viruses that are active, and I'll tell you how I figure out if they're there in a minute, I don't usually want to go after them till 6 to 9 months because I think if you can treat Lyme and get it under better control, the immune system will turn back on and put these viruses under control on its own. So I like working with the immune system to do this. Okay. All right. All right. Now, how do I figure out if somebody has too many viruses? Well, I like doing a test called a nagalase level. And a nagalase is an enzyme that is found in the covering of viruses. And it can become elevated if you have an increased viral load. In other words, if there's a lot of viruses in you, guess what? There's a lot of nagalase, okay? So what nagalase does is very interesting. It's an enzyme that breaks a sugar group off of a chemical called GCMAF. And what GCMAF does is it activates a type of white blood cell called a macrophage. So that MAF and GCMAF, that stands for macrophage activating factor. Okay, so macrophages help fight viruses. And what viruses like to do is they don't want it to get activated because they want to live. Okay, so they make a lot of nagalase to break the sugar group off of GCMAF, which makes it so it can no longer activate macrophages. All right. So you can measure nagalase levels. And if you have elevated nagalase, that suggests you have increased virus load. And so it's probably a better way of looking, okay? Secondly, the reason I like looking at it is, although I mentioned a number of viruses that live in healthy people, it may be that when you have Lyme, it's other viruses than the ones we even know how to identify that could be a problem. So when you have nagalase elevated, you actually get a sense of whether you have chronic virus activity that's increased, and then you can just treat for viruses in general and not have to know which one you're going for. Okay, so you get that lab. The lab that does it is a lab out of New Jersey called Health Diagnostics. Your doctor would have to order it's a blood test, but I would encourage you to do that. And I usually am going to treat if somebody has a level on their nagalase of 1.2 or higher. The lab will report normal up to 0.95, but I find benefit of treating for 1.2 or higher on a nagalase level. Okay? All right. Now, do I think that Valtrex is useful for Epstein-Barr virus? No. Valtrex is a medicine for herpes. It's a medicine that was designed to treat genital herpes, which is a very common infection. If you've kissed people or had sex with people before, perhaps more than one or two partners, you probably have picked up herpes. It's a very common sexually transmitted infection that can be that you can get either as cold sores or and from somebody that has cold sores brewing that they don't know are there, or you can get the genital variety from being sexual as well too. And so if the Valtrex is killing something, I'm not trying to say you have herpes for sure, but I would postulate maybe it's not killing the Epstein-Barr because I wouldn't use it to treat Epstein-Barr. Maybe it's killing some other viruses from the herpes family, okay? All right. What do I do to treat viruses? I tend to like to use three things. Number one, I like using the herb called olive leaf extract. And olive leaf extract comes as a 500 milligram pill. It's useful for treating viruses. You don't even have to identify what the virus is. It's kind of a universal antiviral medicine. You start at 500 milligrams 3 times a day. After a week, if you have not had a Herxheimer from that, then I have people go up to 2 pills 3 times a day. And in another week, if they haven't had a Herxheimer from that, then I go up to 3 pills 3 times a day. Okay. If you are Herxing, don't advance until it passes. Okay. The other thing I like to do is I like to turn the immune system on to help us. And I like using reishi mushrooms to do that. That's reishi, reishi or reishi gano mushrooms. And I would do a 400 milligram pill 3 times a day. There's a sugar that's part of those mushrooms that actually turns on the antiviral part of the immune system. Okay, that's how it works. All right. Then the third thing I would do is to get on a transfer factor product that is targeted to treating active viruses, all right? So transfer factors, for the sake of describing that, transfer factors are proteins that are made by white blood cells when the detective type of white blood cells detect there is an infection there, okay? So for this discussion, I like to divide the immune system into two parts. There's the detective white blood cells and there's the army white blood cells, okay? Detective white blood cells see if there's an infection there, and they have to communicate to the army to turn on to fight that specific infection. And they use two general messengers. One is cytokines. So we've talked about cytokines tonight. Even though I say in Lyme they're kind of bad because they're made in excess, actually their purpose is to turn the immune system on. The trouble is in Lyme they're made in excess, which suppresses the immune system, okay? But in the right amount, they can actually globally turn on the immune system to rev it up to fight an infection, okay? But those cytokines don't target the immune system. What targets the immune system to fight an infection is transfer factors, all right? So for every kind of germ that is in us, we have transfer factors our immune system makes against it. So we have cold virus transfer factors. We have strep throat transfer factors. We have Bartonella transfer factors, okay? And there's a transfer factor product made by Research Nutritionals called transfer factor plasmic. That's PLASMYC. And I would do 1 pill twice a day of that. And it targets against a whole host of different viruses. I've looked at the list before. I think it's like 12 to 15 different viruses, okay, including the Epstein-Barr. So I would do that 1 pill twice a day to target the immune system. To globally turn on your immune system in a good way, I would use the mushrooms. That's what it's doing, the reishi mushrooms I was just telling you about, 400 milligrams 3 times a day. And then I would take your olive leaf extract and work it up to 500 milligrams 3 pills 3 times a day, but work up to it because otherwise you're going to have a huge Herxheimer reaction and you won't be happy about that, all right? Do I think Valtrex is good for Epstein-Barr? No, I don't. It just is not made for it. It's made for herpes viruses, not the Epstein-Barr virus, okay? And then again, I would go back and rethink about whether you even need to be treating it because I would look at a nagalase to see if you actually have elevated viral load, okay? All right. So that's a lot of words. I hope that gives you some useful information. I have written a whole article about how do you diagnose and treat viruses too. I'll just do a quick screen share on that. Back into the Treat Lyme book. And I would look in my infection treatment plans chapter here. And then take a look at this article called When and How to Treat Chronic Viruses, a Brief Guide. Okay. That has everything in there about nagalase, about my approaches to treat as well too. Okay. All right, let's go back here. Question, and thank you for that. Thank you for the question too. Bear with me here, everyone. Hello, Jackie. Hold on here a minute. All right, let's see here. Hi, after being on antibiotics for a year and doing well. Oops, we already answered that earlier. Get rid of that. Hello, Barb. Let's see. Hello, Dr. Ross. I have Lyme and co-infections and I'm not responding to herbals or prescriptions. My autoimmune blood tests show positive and I have had slow leg weakness with 24/7 headaches since 2014. Yesterday, I inhaled toxic fumes in a room for 10 minutes from floor stain and it sent me into a tailspin today. I'm sorry to hear that, actually. Let's see here. Today, my legs are much weaker. I have extreme pain in the frontal lobe, throbbing, pressure all over, red eyes, weakness, fatigue, cognitive issues. I feel like MS set in overnight. Should I see a neurologist or a Lyme literate medical doctor? There are no LMD neurologists in Chicago. Please help. Thank you, Barb. All right, Barb. So I probably would wind up trying to get in and see an LMD to make sure to get help in general. I mean, if your current antibiotic approach, herbal and prescription is not working, you need to get somebody that has some skills being able to help figure that out. Okay. Secondly, though, more acutely, when you have a toxic fume exposure such as you've had, what that probably has done is it's triggered a huge cytokine surge, all right? Also, some of those toxins may be in you and they need help getting out, all right? So, number one, I would get on some liposomal glutathione. And I would get at the Trifortify product that I've mentioned a number of times tonight, the Research Nutritionals product. And I would look at, because of what's happening with you, I would wind up doing 5 milliliters twice a day. Second thing I would do to lower those inflammation cytokines is I would start on the Thorne Mariva 500, and I would do I would go pretty high dose than that. I would do 2 pills 3 times a day, okay? Other thing I would make sure you're doing is to make sure you're having regular bowel movements so you're pooping toxins out too. And so if you're having 1 bowel movement a day, great. If you're having less frequent than 1 bowel movement a day, then you might add magnesium anywhere up to about 400, 600 milligrams at nighttime. It can help with sleep, but also it will attract water into your intestines to loosen your stools so you're having regular bowel movements, okay? Those are some thoughts that I would have for you. If you can't get into an LLMD and you actually need more acute help, you could look at doing my online consult. I actually mentioned that earlier. Let me show everyone how you would do that here real quick. And I would encourage you to actually read all the way through it. It gives you the ins and outs of how this works, including disclaimers. But through this online consult, I could give you some better advice based on your particular situation. Okay? Back here. Lyme book at treatlyme.net. Okay. All right. Barb, good luck to you. Hello, Kobe. Hold on here a minute. All right. Hi, Dr. Ross. Let's see. On hygienics, I recently tested positive for tick-borne relapsing fever, immunoblot, and negative for Babs and Bartonella fish test. How would you treat a tick-borne relapsing fever with antibiotics? I have been positive for Western blot over the past several years and treated it with antibiotics. A cognitive brain impairment continues. Trying to see if there's a second part here, Kobe. Kobe, if there was more to your question, I don't see it. So let me just make a couple comments. So with the tick-borne relapsing fevers, generally the same approaches that we use to treat Lyme are going to work for tick-borne relapsing fever, okay? So I would want to make sure probably that you were on tetracyclines. I would want to look at probably doing 100 milligrams to 200 milligrams of doxy twice a day. And I might get you on some grapefruit seed extract. Those are probably some approaches I would do. But if you've done that kind of stuff already and you're still not getting well, it may be that at this point, this is a false positive test. I mean, there's always that possibility too. So relapsing fever means you get relapsing fever. So you need to see, are your symptoms consistent with tick-borne relapsing fever, which is every month or so you have temperatures that go high. If you're not having that, then I become suspicious as to whether it's actually tick-borne relapsing fever or not. Okay? All right. Good luck to you. Hello, Corey. Let's see. Thanks, Dr. Russ, for being here. You're welcome. Let's see. I'm on Ativan 0.5 milligrams 3 times a day. TID is 3 times a day, everyone, for anxiety and persistent vertigo. It helps with both of these problems, and while I would like to get off the Ativan, don't feel I can function without it. Are there other treatments for the vertigo and anxiety you might recommend? So by vertigo, I want to be clear, we're all talking the same thing, okay? So vertigo means a sensation of being out of balance or spinning, okay? Kind of like a merry-go-round feel. And can come from either involvement in a part of your brain called the cerebellum or some dysfunction of the inner ear balance apparatus as well, too, all right? there is the medicines we use for vertigo are the benzodiazepines like Ativan, Valium sometimes can help. Or there is an antihistamine medicine called Antivert that can help as well too. So if you want to look at an option different than Ativan, you could try a prescription called Antivert, also known as meclizine, 12.5 milligrams, 25 milligrams one time. I think you can do it up to 3 times a day. I'd have to look that up to be sure. The downside is it can make you sleepy. Okay, but the big thing though. But the Ativan will help with anxiety, and the meclizine will not. Okay, all right. From a prescription or an herbal medicine standpoint, the one thing that acts and binds to the same receptors that Ativan does is valerian root, actually. And you would want to get one kind of strain. So there's some strains of valerian that can stimulate you, but Valerian officinalis, and it's Officinalis, officinalis. That one is a strain that actually can have some sedating properties too, and it binds to the same receptors, nerve receptors in the brain that Ativan does, okay? And so you could consider doing maybe 150 milligrams 2 or 3 times a day to see if that might help calm with anxiety and even calm with the vertigo. Beyond that, from an herbal standpoint, I don't have good options for you. In terms of those symptoms, though, I would look at, from a germ standpoint, I'm thinking Lyme, and I'm wondering about Bartonella. I'd have to ask you a lot of questions to see if you have Bartonella. And I showed you earlier the article that you could read to see if you might have Bartonella as well, too. The other things you might want to consider for vertigo and anxiety that can be quite helpful is a type of osteopathic treatment called craniosacral therapy. It involves a practitioner taking and applying light pressure to the various bones of the head. In fact, the pressure is so light, it's the weight of a nickel. It's equivalent to the weight of a nickel, 5 grams. And they apply pressure to the various bones of the head in a way that can help alleviate or influences the flow of spinal fluid through the brain that has a calming effect and can help irritated nerves and even help with anxiety. Okay, that's called craniosacral therapy. Sometimes massage therapists are trained to do it. Sometimes osteopathic physicians do it, and some MDs that do integrated medicine like myself, we do it as well too. If you're trying to find somebody in your area that might do it, there's an institute called UpLedger Institute, that's UpLedger, that has trained a lot of people to do craniosacral therapy in the country. You could go there. They have a doctor finder or a practitioner finder section there, and you might be able to identify somebody that way. Finally, the other thing that can be quite helpful in situations like this is acupuncture. And it needs to be in the hands of a skilled acupuncturist. If you are in the Seattle area, my favorite acupuncturist here is located up in Shoreline, north of the city. His name is Randy Clare, that's Clere, and he does a wonderful job with these kind of problems. But acupuncture could be a way of going as well, too. His practice is called Wisteria Healing Arts, and he's just a marvelous healer and can help out with situations like this, too. All right? All right. Good luck to you. I hope that gives you some insights. Hello, Marnie. Let's see. What causes the eyelids to swell overnight, and how can I treat this? Is this also related to headaches and pressure in the frontal area? So, swelling of the eyelids, sometimes if it's occurring at certain times of the day, like at night, one thing I would ask, and I would need to ask you a lot more questions, but this is just one avenue to consider, okay? Are you sleeping with a pet at night? Are you sleeping in a place where your pets sleep? All right. So some of us, our pets will sleep on our beds or sleep on our pillows, or our cats will be there too. And if so, you could be having some allergic reaction that's showing up with puffiness of the eyes. So that's one thing I would ask. Beyond that, I'm not quite sure. I would probably need to ask you a few more questions to help figure that out. All right. Good luck to you. Oh, hi, hi, Marge. I meant to cross that out before printing it up. Hello, Randy. Let's see. I've relapsed big time in the last 2 weeks. Only this time, asthma has come along with all the Lyme symptoms. Been wheezing with bad congestion in the lungs and esophagus, causing a hoarse voice. I've been to the doctor 3 times and have gotten shots of steroids, which I know is very bad for Lyme. Thoughts. Yikes. The yikes is the steroids. I understand you know the ramifications of that. So everyone, steroids in Lyme is not a good idea because it can suppress the immune system, which allows Lyme to get more active. Okay. All right. So when I hear a story of somebody suddenly getting worse, triggering asthma, I think yeast, I think yeast, I think yeast, and I think yeast again in the intestines. Okay. And you're thinking, what the heck does that have to do with asthma? Okay. So hear me out on this. All right. All right. So yeast, again, you're a setup for getting yeast. I don't even care if you're doing things to prevent yeast. Just by being on antibiotics, you are a setup for yeast. That is, even if you're using probiotics, you're on nystatin or diflucan periodically to get rid of yeast, you can still get too many yeast, okay? All right, so 60 to 70% of the body's immune system, immune cells, line the intestinal tract, okay? 60 to 70%, that's pretty big, all right? And so what happens is if you have too many yeast in your intestines, those immune cells see the yeast and make excess cytokines, all right? And remember, your Lyme symptoms are really excess cytokines. So now, if you've got something else triggering excess cytokines, it's going to trigger all those symptoms that look like Lyme and make it look like your Lyme got worse, but it's really too many yeast in the intestines triggering increased cytokines, okay? All right. How does this relate to your allergies or to your asthma? Okay, so asthma is an allergic type condition, all right? And if you get too many yeast in your intestines, the immune cells, those 60 to 70% of the body's immune cells, they're going to see those yeast and they're going to react allergically and release histamines, the allergic chemical, right, into your bloodstream, which goes up here, triggering inflammation, making asthma worse, and can even give you a bunch of sinus stuffiness, runny nose, even puffy eyeballs, okay, up here, even though the problem is going on down in your gut. All right. So I've had patients I've gotten rid of their yeast, treated their yeast, and suddenly their years of using asthma medications, they don't need them anymore. All right. So that's what I'm wondering. Just your brief description here, I'm wondering if they're missing intestinal yeast. Okay. So why would you think of intestinal yeast? Well, because of the symptoms you just told me, which is all your Lyme symptoms got worse, which means your cytokines are up and you've got worsened asthma, okay? But other things that can suggest too many yeast are increased sugar cravings, increased intestinal gasiness and bloating, changes in your bowel habits, constipation, diarrhea perhaps, vaginal itching, vaginal discharge might be some suggestions of that. The toxins that get released by yeast interact with your skin, and some people give acne and pimples. You might have difficulty swallowing. I went through this whole list earlier, okay? But you need to probably get on an effective treatment for yeast. That's what I would look at. So let me just I'm going to do a quick screen share here and show you something you can take a look at later. Yeast, somewhere here. There it is. Okay. And so number one, here's my article called Steps to Fix a Lyme Treatment Crash. This is all about yeast, okay? Notice how I frame it in terms of a crash. You just crashed. Think yeast, okay? So look at that article. Number two, in terms of what do you do to treat yeast, take a look at this article here called Kills Yeast, a Brief Guide, okay? All right, so, and if it is yeast, usually within about 2 or 3 weeks on the right treatment, you'll start having some really good turnarounds in how you're feeling, okay? So Randy, good luck with that. I suspect that's what's going on here, okay? All right. Let's see here. Marty, I'm sorry your audio isn't working. I can't explain. I just checked to make sure I'm not getting complaints for other people saying there's an audio problem tonight, but it doesn't look like it. It looks like everyone's participating fine. I hope you can figure that out. All right. Hello, Val. Let's see. Hi, Dr. Ross. Could you comment on when you would suggest Mediclear versus End Fatigue Daily Energy Infusion vitamin powders for your patients? Thank you so much for webinars. So, all right. So both of those, Mediclear is a product made by Thorne. That's a multivitamin. It's got various nutrients in it that are good for healing Lyme. Okay. And Integrative Therapeutics has a product called Energy Infusion, which also is a good multivitamin. I think a bit more of a comprehensive multivitamin, okay? Now, the Energy Infusion, though, is not good for people that are really sensitive, and the Mediclear is, all right? The Mediclear is tastes like chalk in a way, okay? Because it does not have a lot of flavoring added or fillers added to it, so it's very bland. So if you're not sensitive to a lot of things, I would suggest doing the Energy Infusion. The flavoring is a little bit better. It also is packed with more nutrients than what the Mediclear is. Okay, that kind of just a brief summary on that. All right. Thanks for that question, Val. Hold on here a minute. All right. So let's go on here. Hi, Donna. Let's see. Hello, Dr. Ross. I have been on 125 days of antibiotics: doxy, malarone, azithromycin, Ceftin. 30 days, Ceftin liquid on a PICC line. This is with combination of these supplements: curcumin, 2 curcumin, 250, 2 ashwagandha, 500 milligrams, 2 probiotics, 1 glutathione. You have suggested some of these, and no. Let's see. There's a second part here. You have suggested some of these, and now off the antibiotics, I wanted to add these to the supplements: vitamins C and D, 1 alpha lipoic acid, 1 CoQ10. Do you think these are okay to take together, and do you have suggestions on any others or anything to omit or add? Thanks so much. Appreciated. Let me see here. Bear with me. I'm re-looking at the whole question. So I guess, Donna, I'm not clear how to answer that. And the reason is I don't know what your symptoms are right now. So I don't know enough of what's going on with you to be able to suggest what are the best supplements to add in this kind of a situation, unfortunately. So anyhow, I'm not going to be able to answer it. I'm not clear what's going to be the best thing for you. All right. Thank you for that question. Let's see. Hello, Barb. Let's see. Hello, Dr. Ross. I have Lyme and co-infections and not responding to herbals. Oops, I think we looked at that earlier. Hello, Marge. Let's see. I am currently dealing with intestinal parasites. I'm having a very difficult time getting rid of them. Any suggestion on what works for parasites? Okay. So what I like to use for parasites, I like using a prescription medicine called Alinea. Alinea is a universal antiparasite. You don't really even need to identify what the parasite is. It tends to work against a broad range of parasites. The mechanism by which it works, it should kill most parasites, basically, okay? Be aware that the mechanism by which it works, it also can kill Lyme, probably treats spirochete, maybe cyst Lyme. It's not clear to me whether it treats intracellular Lyme because we have no studies, okay? But the mechanism by which it works, it seems to treat Lyme as well, too. So you use it. It's a 400 milligram pill, and I would do 1 pill 2 times a day, and I would do it for 3 weeks. That kind of tends to be what my approach is, all right? Now, the difficulty is with the linea is it's expensive. If your insurance won't pay for it, it can run that 3-week course can run, I think, around $1,000 or more. So sometimes I may even get it through Canada for some of my patients. Okay. Anyhow, or I send the prescription up there to get it filled up there. Okay. All right. Good luck to you, Marge. And thank you for that question. Hello, Thomas. Let's see. Dr. Ross, I'm dealing with a lot of intestinal pain, burning, and gas. At night it is much worse, and I have chills and uncontrollable body tremors. Could this be due to Lyme or co-infections? Having a lot of fear and anxiety, not going to bed. My doctor wants to test for mold. Any ideas? So, Thomas, I guess the first thing I would do is look at the information I have about figuring out if you might have too many yeast. I know that seems to be my theme tonight. Sometimes these webinars get into themes, but intestinal gasiness, bloating, burning, that means you've got some disturbance of good bacteria, and often that means there's yeast as part of this, okay? So I take a look at the materials I've written about yeast and see if that applies to you, all right? All right. Thanks, Thomas. Good luck to you. Hello, Joel. Let's see. Hi, Dr. Ross. I have heterozygous mutation for MTHFR well, that should be C677T. I think that's what you mean. Do you recommend any supplements I should take to help detox? I have Lyme, Babs, Mycoplasma, and Rocky Mountain spotted fever. Okay. So MTHFR, everyone, stands for methotetrahydrofolate reductase. That's a mouthful. That's what we call it, MTHFR for short, okay? So it's an enzyme. MTHFR is an enzyme. And that enzyme is used to convert folate from your diet, which is considered inactive, to an activated form. And the activated form of folate is something called 5-methotetrahydrofolate, or 5-MTHF, okay? All right. So it's critical to be able to get diet folate converted into the activated folate. And that's the first step in a detox pathway called the methylation process, okay? So now what happens is that's up here. And if you have blockage of, so the first step in the methylation process is converting diet folate to activated folate, okay? And then many, many chemical reactions downstream, all the way down here. The last major chemical in the detox pathway that's made is glutathione, okay? Glutathione is the master detox chemical made in the liver, okay? So if you have blockage up here where you're not getting enough methylated folate, down here, many chemical reactions later, you're not going to make enough glutathione, and you're going to have impaired detox, basically, all right? Now, keep in mind, there's also these other reactions that lead up to glutathione are more minor detox reactions that can contribute to detox, but the big one is glutathione down here. All right. Now, there are a number of genes that program how that enzyme is going to look. All right. And the two major ones are the C677T gene, and the other one is the A1298C gene. Okay. And people that have the biggest problem are people that have defects in both parts of those genes. Okay. So for any gene that we have in us, genetic material we have in us, there's a part contributed by the mom and there's a part contributed by the dad. If you have a defect in one part, that's called heterozygous. If you have a defect in both the mom and dad parts, that's called homozygous, okay? So the people that have the MTHFR problems that have the greatest problem is if you have a defect in both the mom and dad part, homozygous, at both the A1298C and the C677T gene, okay? Those are people that I tend to see in my practice. I clearly get benefit by giving supplements to help overcome the blockage, all right? However, I have been extremely disappointed at the outcomes that I see in patients that have just one heterozygous defect, like you have, okay? So generally these days, I do not treat for a single heterozygous defect of either C677T or A1298C. I sometimes will wind up treating for heterozygous of the C677T and heterozygous of the A1298C, or I will treat if somebody has a homozygous of either one of those, okay? And then I just see over a 3 to 6 month period whether I get any benefit. In general, it's maybe about a 50% chance, okay? So what do you use? Well, I like giving the activated folate that's called 5-methotetrahydrofolate. You can get it as a 1 milligram pill, or you can get it as a 5 milligram pill, or you can get it as part of a product called MethylGuard by Thorne, which also has a methylated vitamin B12 in it. And that methylated B12 is useful because it gives a methyl group into the chemical reactions. So the best option would be MethylGuard that has 5-MTHF and the methylated B12, all right? And the way that I would do that, I'd start at 1 pill 1 time a day. Keep in mind, if you do have a major blockage and you start unblocking it by giving the activated folate, one of the things that can happen is all these toxins that were built up behind the barrier come flooding through, and they can trigger cytokines, okay? So you got to go slow with this. You got to start at 1 pill a day. If that flares you up, then I would back down to 1 pill every other day. You might even do a quarter pill. I mean, you got to find the right amount that works, but usually I start people at 1 pill 1 time a day. If they tolerate that, in 7 days, I'm going to go up to 2 pills 1 time a day. And in another 7 days, if they're tolerating that, I'm going to go up to 3 pills 1 time a day. But again, for your type of defect here, I'm doubtful you're going to get much benefit. All right. Thank you for that question, Joel. Hello, Heidi. Let's see. Hi. What is the best way to treat systemic candida, and is sauerkraut good or bad for candida? All right. So I want to be clear about something. People generally don't get systemic. Systemic means that technically, systemic means you've got yeast growing in your blood and it's gone into every organ in the body, okay? If that was so, people like that die. I mean, that's how bad it is, okay? But you can have a systemic reaction to yeast in your intestines where the infection, the yeast is just there in the intestines. And the systemic reaction is your immune system sees them and makes too many cytokines. And those cytokines give you the whole host of Lyme symptoms. And that's usually what people have, or that generally when people say systemic, that's what they have, okay? All right, so what's the best way? Number 1, be on something to lower cytokines. I like being on curcumin, 500 milligrams 3 times a day. Number 2, you got to kill your yeast. And my starting place for most people is a prescription medicine called nystatin. It comes as a 500,000 international unit pill. And I like to use it as 2 pills twice a day. That's a prescription. And I like to combine it, especially if somebody's never been on this medicine before, with diflucan, or if they've only been on it a limited number of times. Diflucan, 200 milligrams, 1 pill 3 times a day. Okay, diflucan's the bazooka. Nystatin helps, and I find better success in using both together. All right. Now, if you've been on diflucan a lot, then there's the chance that your yeast may have learned resistance to diflucan, in which case I'm going to not use diflucan. I may use a brother sister of it called Sporinex, also known as itraconazole, and I would use that as a 100 milligram pill, 2 pills 1 time a day for 30 days, okay? So those are just some starting points. I've written a comprehensive article about other options, and you can take a look at that in the Treat Lyme book. I showed that to everyone earlier tonight, okay? All right, good luck to you. Hello, Paul. Let's see. You've recommended biocidin. I think per the bottle it contains polypropylene glycol. Should I be concerned about that? Thanks. No, I don't find that to be a problem, actually. I find good benefits from the product overall. All right. Thanks for that question, though, Paul. Hello, Judy OC. Can I use your biocidin liposomal formula, which is the biocidin LSF for everyone, as a standalone treatment? My doctor wants me to also add Dr. Rawls Restore Kit with it. Love your Lyme book. Have the lifetime subscription. Thanks, Judy. Thank you for that comment. So The biocidin would be a complement product to Dr. Rawls' Restore Kit. Okay, I don't see, those two are separate. They're going to be doing different things. I have been using biocidin in some of my patients as a standalone treatment, meaning it can treat Lyme without having to be on anything else. Because again, according to Petri dish experiments, does a good job of treating all three forms of the Lyme germ, and it removes biofilms, and it blocks these efflux pumps that throw the antibiotics out. Okay, so yes, I've been using it that way, and I would see no problem with you mixing it with some of Dr. Rawls' Restore Kit as well too. All right. All right. Good luck to you, Judy. Thank you for that question. Let's see here. Hello, Jen. Let's see. My daughters, ages 11 and 12, are supposed to take clarithromycin for Lyme. Is that safe for kids? Should we test their liver and kidney functions periodically? If they have any side effects, are they typically permanent? One of our daughters has tachybradycardia over 235 and below 45. Okay, so generally, clarithromycin is a fairly safe drug to take with kids. And I have never found elevated liver enzymes or problems with kidney function, although I might test after about a month or 2 months to see if they're tolerating. Generally, it's safe, okay? The only issue I have, though, is based on what you just described, clarithromycin can sometimes trigger skipping of the heart. Now, I didn't say racing of the heart, but skipping of the heart. And your daughter has slow heart, bradycardia, that goes to tachycardia, which means fast heart. And so it's maybe a little tricky to figure out what's going on with her heart. Is it coming from the clarithromycin or not? So you might look at some other options with your prescribing doctor over that. Okay? All right. Good luck to you. Thank you for that question. Let's see. Hello, Barb. Let's see. My daughter tried prescription and biocidin for SIBO. She is 15, has Lyme, Babesia, Mycoplasma, yeast, and labs, with possibly other co-infections. She has not yet been treated for Babs or Mycoplasma, I think you mean. Her local Lyme, like MD, has her on herbals. Her brain fog, thyroid, and female hormones are low with no cycle for 6 months. And I think Lyme is affecting the pituitary. Her situation is worse, and I'm not sure how to proceed. There are many layers since her SIBO is not improving. Should she start a parasitic protocol with the Malarone treatment or Babesia? Barb, I actually don't know. And the reason I don't know is from what you just described, I have a lot of questions. I'm not sure what the best way is to guide you. I'd be glad to help you, though, and you might want to take a look at my one-to-one consult service that I showed everyone earlier tonight. You can find it at the Treat Lyme book, where I can give you advice. But this would be too complex for me to venture a guess as to what's the best way to go. I actually need to know more about what she's been on, what herbal options have been tried, what other things have been tried, so I can help give you advice on where do you go from here. Okay? All right. Sorry about that, but thank you for that question, though. All right, let's see. This is another one. I don't know if you're the same Barb, but another question here. Dear Dr. Ross, my daughter, 14 years old, has Lyme mycoplasma since July 2017. She's beginning to experience headaches and fatigue and brain fog. She was on Doxy and Pulse Tindamax for 5 months, now on herbals. Can you advise how she should just be treated to get the Lyme and co-infections under control? So, again, this is complex. It'd be hard for me to venture totally. However, when I see a picture where somebody's been treated and they get worse with treatment, I always want to make sure that yeast has not moved in the intestines. And I've talked about that a number of times tonight. If you missed that part of the webinar, go back and listen tomorrow to the recorded version. But I would be considering, is there yeast here? I have a lot of other questions to ask too. It'd be a little bit complex for me to venture a guess here. Again, take a look at my consult service if you want to do that as well too. Okay? All right. And good luck to you. Hi, Dr. Marty, and thanks so much. New studies show that Morgellons filaments are keratin, and Morgellons is similar to bovine digital dermatitis. Seems that there must be a genetic link and something has to turn on the switch. Thoughts? Ideas about causative elements? Where? Who are the latest studies? I guess I don't know. I haven't seen that study, so I'm not going to be the best person to respond to that. The thing I do know about my Morgellons patients is that about 95% test positive for Lyme, and that as I treat their Lyme, their Morgellons clears up. But I don't have any more information about the specific question that you're mentioning here. All right. Morgellons, everyone, is a skin condition that can occur in people that has a bunch of filaments associated with it. And to date, mostly we haven't been able to identify what they are, although clearly this one study suggests it might be the keratin. Okay. Anyhow, thanks for that question. I'm sorry I can't give you a more detailed response on that. All right, everyone. That is it for me for tonight. I have another webinar scheduled for next Wednesday. So I'm going to go out the last day of the month. We're going to go out with a webinar. All right. So I hope you'll join me then. Here in a second, I'm going to transfer you over, those of you that are still here. You're going to be sent over to the Treat Lyme book, to the subscription page. If you find this information helpful, you're going to find a lot of it in the Treat Lyme book. Okay, same information here, you're going to find in the Treat Lyme book. Keep in mind that when you subscribe, you have access to all that great information that can give you benefit, and also that actually financially helps the webinars that I'm providing here too. So I'd appreciate if you would subscribe to help me so I can keep helping you. All right. And also, when you support the Treat Lyme book, that provides so that I can keep writing more articles as well too. So thanks for being here tonight, everyone. Tomorrow morning, you're going to have an email from me when the recording of the webinar is complete for your consumption. And again, you can find it on my Facebook page, and you can also find it on the homepage of the supplement store. All right. Good night, everyone. I'm going to transfer you over to the Treat Lyme book. Okay. Good night.